Welcome to the Center for Surgical Weight Loss at Riverside Community Hospital. By the end of the presentation, you will be able to define bariatric, state if you are a candidate for surgery, describe the 3 types of surgeries offered at Riverside Community Hospital, state 2 contraindications to bariatric surgery, describe life after weight loss surgery, describe how to achieve maximum results, and state the next step. The Center for Surgical Weight Loss at Riverside Community Hospital is committed to providing compassionate care to patients seeking surgical management to achieve optimum weight loss. Your bariatric team is comprised of a nurse coordinator to help you navigate the process, a bariatric surgeon, dietitian, and dedicated nurses. Bariatrics is the branch of medicine that deals with the causes, prevention, and treatment of obesity. Obesity is measured by a formula called BMI. BMI stands for Body Mass Index, which is an indirect measure of body fat. This number represents your risk for health conditions identified as comorbidities. Comorbidities are medical conditions that are caused by, or related to another condition. Extra weight may lead to these conditions or comorbidities: coronary artery disease, hypertension, sleep apnea, type 2 diabetes, dyslipidemia or high cholesterol, and osteoarthritis. To measure your BMI, we will use a formula. Visit the website cdc.gov. Search for the Adult BMI Calculator. Take a minute to see what your BMI is. Place your weight and height into the formula and click Calculate BMI. Take a minute and pause the presentation here. Calculate your BMI and come back and push play when you're ready to resume. This slide shows the treatment options based on a person's BMI. Once your BMI reaches 35, surgery may help you lose weight and keep it off. In 1991, no state had an obesity rate greater than 20%. In 2010, 38 states had an obesity rate greater than 25%. 8 states have a rate greater than 30%. Alabama, Arkansas, Kentucky, Louisiana, Mississippi, Oklahoma, Tennessee, and West Virginia. To qualify for surgery, there will be certain criteria you will need to meet. The criteria is based on the indications for surgery, National Institutes of Health Guidelines, or the NIH. 1. BMI of 40 or greater without comorbidities. 2. BMI between 30 and 39.9 with 1 comorbidity. Again, comorbidities are things like diabetes type 2, hypertension, sleep apnea, osteoarthritis, coronary artery disease, or increased cholesterol. Number 3. Tried and failed a non-surgical weight reduction program, such as diet pills, nutrition plans, and exercise. The goal of surgery is to lose over half of excess weight to help reduce or prevent obesity-related health problems. Only surgery has proven effective over the long term for most patients with clinically severe obesity. There is minimal morbidity, less than 5%, and mortality, less than 1%. It is important to remember that surgery is only a tool. To be successful, you must combine surgery with a lifelong commitment to diet, activity, and support. The Center for Surgical Weight Loss at Riverside Community Hospital offers 3 surgical options: laparoscopic adjustable gastric banding, gastric bypass, and sleeve gastrectomy. We also perform revisional surgery for people who have had bariatric surgery and may be experiencing problems. The 3 types of surgeries offered are either restrictive or malabsorptive procedures. Restrictive procedures limit the amount of food by reducing the size of your stomach, and therefore you cannot consume regular portions. The 2 types are sleeve gastrectomy and adjustable gastric banding. Combination procedures limit the amount of food and calories absorbed. This combines restrictive and malabsorptive surgery. The size of your stomach is reduced, and the intestines are altered so calories are not absorbed. The one type of surgery performed is called ROUX-EN-Y gastric bypass. In normal digestion, the esophagus is a tube that carries solid foods and liquids from the mouth to the stomach. The stomach is a storage pouch. Food arrives here after swallowing, where it is processed before passing to the small intestines. The small intestines are about 20 to 30 feet in length and where the majority of nutrients and calories from food are absorbed. The large intestines are the final section of the digestive tract where water is reabsorbed into the body from the leftover liquid from digested food. We will now go over what is involved with each procedure, show you a short clip of the surgery, and discuss the benefits of the procedure. First, the ROUX-EN-Y gastric bypass. A small pouch is created at the top of the stomach. The small bowel is cut, and the lower part is connected to the stomach. The small bowel connected to the detached stomach is reattached to the bowel coming from the newly developed stomach pouch.
Gastric bypass is a restrictive and malabsorptive procedure that results in fewer nutrients and calories being absorbed. It reduces food intake by cutting and stapling the stomach to make a small stomach pouch. The small intestine is cut and the lower section is directly attached to the new pouch. Food then passes directly into the lower portion of the small intestine, bypassing most of the stomach and upper intestines.
The benefits of gastric bypass include long-term data is available, no foreign body, more effective weight loss and type 2 diabetes resolution than with sleeve gastrectomy or lap band. No need for additional visits for band refills, and can lose 80 to 100 pounds or 62% of excess weight. The next procedure is the sleeve gastrectomy. A narrow tube is made with a surgical stapler from the pylorus valve of the stomach to the esophagus along the inside curve of the stomach. The remainder of the stomach is removed and cannot be reattached at a later date. The normal digestive process remains since the valve at the bottom of the stomach was not altered. You will have the normal process of stomach emptying, but will get a feeling of fullness sooner. A hormone called ghrelin is in 2/3 of the stomach that was removed. The hormone stimulates your appetite, so if it is removed, you'll get a feeling of fullness quicker and take in fewer calories.
Sleeve gastrectomy is a restrictive procedure that limits food intake by cutting and stapling a thin vertical section of the stomach to make a smaller, narrower stomach pouch. The remaining larger portion of the stomach is then permanently removed. Unlike gastric bypass, there is no rerouting of the intestines. However, the sleeve gastrectomy involves permanently removing a large portion of the stomach.
Some of the benefits of sleeve gastrectomy are no foreign body, no additional visits for band refills, less or absent nutritional deficiencies, greater appetite suppression, can be performed laparoscopically on people with a high BMI, can lose up to 55% of excess weight. The final procedure is the adjustable gastric band, also known as the lap band. A band is placed around the top section of the stomach. It creates a small pouch which limits food intake. A small port is placed on the left side of the abdomen under the skin, which is used later to make the pouch smaller or larger. This port is used for the adjustable fills.
During a minimally invasive procedure, an adjustable band is placed around the upper part of the stomach, creating a small pouch. The band is connected by thin tubing to an access port below the skin. Through this port, your surgeon adjusts the lap band by inflating or deflating the inner lining with saline. As the band inflates, the stomach outlet becomes smaller. This helps reduce or restrict the amount of food you eat and slows the emptying into the lower stomach, helping you feel full sooner and stay full longer.
Benefits of the lap band include lowest rate of complications when compared to bypass and sleeve, no rerouting of the anatomy, no stapling of stomach, no anastomosis, or the joining of or opening between two organs or spaces that normally are not connected, and you can lose up to 43% of excess weight. The advantages of the laparoscopic approach are less invasive, less pain post-operatively, fewer wound complications, shorter stay in the hospital, and a quicker return to work. The two approaches to performing bariatric surgery are open and laparoscopic approaches. Today, Most approaches are performed laparoscopically, where a small incision is made in the abdomen for a surgeon to insert a camera to view internal spaces. They offer small incisions and are made to insert instruments. Possible side effects of bariatric surgery may include nausea and vomiting, gas and bloating, dumping syndrome, lactose intolerance, temporary hair thinning, depression and psychological distress, changes in bowel habits. Your surgeon will discuss these further with you during your consultation. Possible complications after surgery may include infection, bleeding, or leaking at suture lines, blockage of the intestines or stomach pouch, dehydration, blood clots in legs or lungs, vitamin and mineral deficiency, protein malnutrition, incisional hernia, irreversibility or difficulty reversing some procedures. Revision procedures are sometimes required. And death. Who is not a candidate for bariatric surgery? Non-adult patients under the age of 18. Conditions that may render you a poor surgical candidate or increase the risk of poor results. Unwilling or unable to comply with dietary restrictions. And currently pregnant or may be pregnant. The Center for Surgical Weight Loss at Riverside Community Hospital uses Colleen Cook's Success Habits principles to help patients stay on track. These include items like personal accountability or taking responsibility, portion control, eating less, nutrition, decreasing sugar and fat in the diet, fluid intake, staying hydrated and not drinking until 30 minutes after eating, regular exercise, and vitamins and minerals. Colleen, a weight loss surgery patient herself, says we feel deprived when we are forced to follow rules. Therefore, she calls her Success Habits principles because we feel guided and directed by our own best choices. These principles work no matter which weight loss surgery procedure you have. Additional postoperative results can be best achieved by attending a support group. This is another part of the healing process. All patients are encouraged to attend a support group monthly after surgery. Patients will be able to interact with people who know what they are dealing with. Lifelong commitment. Your emotional and physical well-being is dependent on your commitment. Be sure to ask your surgeon what is expected of you and make the commitment to maintain your well-being. Most patients return to work within 2 to 4 weeks. However, everyone is different. Go at your own pace. Taking the next step. Part 1. Insurance verification. Your nurse navigator will work with you to find out what is covered and covered expenses when it comes to your bariatric procedure. Only if it's deemed medically necessary do insurances usually cover expenses. Remember, list your past weight loss attempts. No cutting corners. Be as thorough as you can. Over-deliver on your information. Part 2. Schedule an appointment with a bariatric surgeon. Go to www.riversidecommunityhospital.com and see our list of bariatric surgeons. Typical patient pathway for the Center for Surgical Weight Loss is shown here. Pause the presentation and take a moment to review. When you're ready, push play. So to summarize, surgical weight loss is a tool. Long-term success depends on you. Success depends on lifestyle modification. Many comorbid conditions are eliminated with bariatric surgery. You'll be learning about lifestyle modifications, and that will help you keep the weight off. We look forward to providing you with personalized and quality care on your journey as you pursue your weight loss goal with Riverside Community Hospital.